Hi guys, it's me, and I'm just back. I'm back with another video. So, I just wanted to talk to you guys briefly about this new and exciting opportunity that I've been blessed to have. I don't know if you guys remember, but a while back I was telling you guys about how I was working a full-time job and how that job wouldn't allow me to go part-time, and how I had to quit that job essentially. And how when I started nursing school was like just so much, and it was just a lot to absorb and take in and figure out the swing of things initially in the beginning. So I didn't look for work in the beginning. So I have been wanting to tap into the cosmetic realm of nursing for a while, and I didn't want to be one of those people who just basically graduated and tries to throw myself in there, because I felt like I would have a harder time, because it's a lot of things that you need to know in the beginning in order for someone to allow you to work independently on your own as a nurse. So it's not like a real hospital job where they just throw you to the wolves and just allow you to figure things out. The cosmetic realm is a little different because it's a little bit riskier, especially I would say when you're going underneath the skin of a patient, and especially when people are looking for cosmetic procedures to make them look better. They want to make sure that you know what you're doing, that you're confident in what you're doing, and that you can do it well. So I have been looking into several med-spas, cosmetic surgery centers, and dermatology centers. But what I have been finding is a lot of these places do not allow certified nursing assistants to work there, nor do they allow student nurses to work there. Now, I can kind of understand why they wouldn't want a student nurse, because basically you're not licensed and therefore they can't allow you to do a lot of the procedures that they provide. As far as not wanting a certified nursing assistant, I kind of understand that too. Certified nurses assistants are more so for bedside manner things and not really basically direct patient care per se. Well, they do a lot of direct patient care, but it's more so like prevalent to a hospital or nursing home or something to that matter. But when you have a medical assistant may be able to draw blood and do things like that. So maybe that's the concept and why they would prefer to have a medical assistant versus a certified nursing assistant. However, I was able to bypass that, y'all. I came up on a networking event that I attended, and when attending, I just started talking about what I was passionate about and what I wanted to do, and somebody basically put me on. So I got a job, y'all, and the job is at a med-spa, which is somewhere where I always wanted to be. And it allows me the opportunity to learn and grow with the company because it's relatively new, and I'm excited, y'all. So I'm gonna tell you a little bit about some of the procedures that we provide and some of the things that I will be doing. So one of the procedures that they do at the med-spa is called chirotherapy. So I don't know if you guys may have heard of this before or may saw it on social media, something like that, but typically like people who are athletes, they typically enjoy it because basically what it is it allows you to go into this chamber, and the chamber is really cold. It like can go like I think to a negative 150 degrees, and you basically stay in there anywhere from 1 to 3 minutes max, because if you stay in there too long, of course you'll freeze to death. But the thought is that it will help you reduce pain and inflammation within your body. So you will see that with a lot of people who have chronic pain or muscle fatigue. They like that particular service. So it's non-invasive, so and it's pretty quick, so people enjoy it. So that's one thing I'll be doing. Another service that they provide is called hyperbaric therapy. So with hyperbaric therapy, it's basically a chamber that you go in, and within the chamber they deliver basically like 100% pure oxygen to you. And basically it doesn't allow your body to use the oxygen within itself, and allows you to rely 100% on the oxygen within the chamber. And the thought of it is that if you sit in there long enough and do enough sessions, that you can heal basically inside out. So a lot of people who use this therapy is like maybe a cancer patient who's going through chemo, maybe somebody who is suffering from gangrene, someone who has very bad necrotic tissue, diabetic neuropathies, and procedures like that. So this procedure can get a little costly. Some people do pay out of pocket, but it's best to go through insurance because it's expensive. So other services that we provide would be IM injections, and those IM injections can be for things like Crohn's disease or multiple sclerosis or things like that. And that's basically just a simple shot of intramuscular injection. Sorry guys, some noise going on outside, but basically it's like an intramuscular injection that you will receive, very small, minor. Some other procedures or services that you can receive would be like IV injections. So let's just say one day you were like super shit face wasted and you basically were dehydrated and you felt like you just couldn't move and you couldn't do anything. That's a service that we provide. Basically replenishing those fluids back to your body to basically get you back and running to 100%. And it's just a faster way to deal with a hangover, nothing too fancy. Other services could be like, let's just say if you have a B12 deficiency, you can get infusion for that. Or let's just say, back to my athlete example, let's just say you're a real heavy lifter in the gym and you basically have a hard time recovering from those workouts that you're having. You can come in and you can get an IV infusion that will basically take away the pain and the fatigue that your muscles are experiencing. So it's a lot of other different services that we do provide, but those are just like a basis just to kind of give you an idea of some of the things that I will be doing there. And y'all, I am looking forward to this. I've been to training already 2 days and the doctor is already looking to throw me in there and get me going. So I just wanted to share that with you guys because it's actually happening before me and it's happening faster than I thought, that I am actually starting to do something that I love within the field of nursing and I am enjoying it. So if you guys have any questions or any comments, please share them with me below. And until next time, guys, I'll see you. Peace.